My name is Daniel Diaz-Aguilar. I'm a neurosurgeon and spine specialist at Floyd Healthcare. People have these immense problems that are very difficult to deal with and talk about and treat. And I view myself as someone who has the ability and the opportunity to help people who are dealing with some of the most profound issues, whether it's a cancer, chronic back pain, etc. And what brought me to Floyd Valley specifically is a need within the community to bring some of this high-level academic sort of care to the people of my community. As a neurosurgeon, I specialize specifically in the spine, but I am open to the entire neuroaxis, so diseases of the brain, peripheral nerves, carpal tunnel, the spine itself. It's hard to tell when someone needs a neurosurgeon or they need to see another type of specialist. And I view myself as having a very low barrier to seeing any sort of patient with a problem, so that if I'm not the person who helps solve what's going on, I can at least direct them to the right specialist. I was born in Georgia. I spent my high school years in California. I went to my undergraduate at Johns Hopkins University. Then I went to UCLA for medical school, where I met my wife. And that's when we entered our residencies at UC San Diego. My wife is also a surgeon. She's a head and neck surgeon. So we both are extremely busy, but we found the time to have 4 kids, and we're having a really joyous time of that. When we do have time, the wife and I enjoy rock climbing, we enjoy hiking, we both are avid mountain bikers, and so we just really try to enjoy life in any aspects that we can. What I love about neurosurgery is that very frequently, if there is a problem, we can fix it. We can identify the problem on the scan, we can discuss the alternatives and the benefits to proceeding with care now or surgery later. What makes me proud to serve the Lamar's community is that these patients may have had a much larger barrier to accessing some of the care that we're able to provide now, within their own backyard, within their community. No one enjoys going to see a doctor when they have to go see it, all right? It's not easy being a patient, let alone the need to have to drive to a separate town just to be able to see your primary care or a specialist care. And so by making CNOs and myself available in this community, I view that people who otherwise are too busy with life, taking care of their kids, taking care of their jobs, et cetera, now have the ability to take that small window in their afternoon off versus making a whole ordeal, a whole trip with babysitters, etc., to be able to seek out the care that they need. And then that in turn allows them to advance their medical care in a way that would otherwise have been delayed and potentially could have been a much larger problem down the road. I see the patients very quickly spread through word of mouth. Oh, I saw you saw my friend, I saw this person, etc. Because everyone is very well connected here and in a way that is so positive that allows us to, serve one person, and that lets me know that I have impacted multiple lives almost immediately.